This video will cover the extrapyramidal tracts of the spinal cord, including the rubrospinal, reticulospinal, and vestibulospinal tracts. These tracts do not pass through the medullary pyramids like the pyramidal tracts from the previous episode, hence the name extrapyramidal. The rubrospinal tract sits in the lateral white column. The reticulospinal is split into two tracts, the medial, aka pontine, and lateral, aka medullary. The vestibulospinal tract is in the anterior white column. The rubrospinal tract originates from the red nucleus, which is a midbrain structure that appears red on dissection due to lots of vascularisation. As the fibres come out from the red nucleus, they decussate, cross over to the other side, and then descend into the spinal cord, where it then runs to the next to the lateral corticospinal tract. The tract then terminates in the upper cervical segments of the spinal cord. The full function of the tract is not fully known, but it does supply fine motor movement to the upper limbs, such as fine hand movements. The medial, aka pontine reticulospinal tract, originates from the pons in the brainstem, then descends through the medulla into the spinal cord without crossing over. The fibres then terminate in the spinal cord, passing signals to the muscles. This tract allows voluntary movement and increases the muscle tone. The lateral, aka medullary reticulospinal tract, originates in the medulla in the brainstem. The tract is a bilateral system, so some neurons will decussate and descend on the opposite side, contralaterally, and others will descend on the same side, ipsilaterally. They pass into the spinal cord and terminate at all levels of the spinal cord, passing signals to reduce tone and inhibit voluntary movements. The vestibulospinal tract originates from the vestibular nucleus in the medulla, which collects information from the vestibular organs of balance. The tract is split into medial and lateral according to the part of the nucleus that they arise from. The tract then descends down into the spinal tract without crossing over, whereas the medial tract descends on the bilateral side, opposite. The lateral tract then terminates with neurons supplying the anti-gravity muscles in our legs, allowing us to stay upright and balanced. The medial tract terminates with the neurons of the cervical spine, so our head can remain stable in relation to the body. Extrapyramidal damage can happen due to degenerative diseases, encephalitis, and tumours. These cause disorders of movement and balance called dyskinesias. So if someone developed a tumour of their red nucleus, what symptoms might they get, and why? Pause here to think of an answer. They would get some loss of fine motor function of their upper limbs due to the disruption of the rubrospinal tract. A second patient developed scarring of the vestibular nucleus in the medulla due to degenerative disease. What symptoms would they experience and why? Pause here if you need to. They would lose the anti-gravity function of the muscles in their legs and the stabilisation of the head and neck, leading to a loss of balance and an inability to remain upright. In summary, the rubrospinal tract originates from the red nucleus and immediately decussates to then supply the upper limbs with fine motor movement. The pontine reticulospinal tract originates from the pons and does not cross, giving voluntary movement and muscle tone to the limbs. The medullary reticulospinal tract originates from the medulla and runs bilaterally to reduce muscle tone and inhibit voluntary movements. The vestibulospinal tracts originate from the vestibular nucleus, with the lateral tract descending ipsilaterally to supply the anti-gravity muscles in our legs.